Welcome to Black Health Matters. I'm Daryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
Thank you, Daryl.
What time is it where you are, Daryl?
It's 8:03 here.
Okay.
Okay. John, you ready to start? There's an interesting article about people who have cataracts and those who haven't removed are 30% less likely to have dementia, which is
lucky
let
me.
me go get mine out now.
Lucky me.
So, well, life is so full of so many things these days. Well, John, you want to start the show?
Yeah, I got kicked off for a second. Let's see, I'm getting back in. Tatum.
Okay.
Yep, he's back in. My cousin's on here. Mary Ellen, where are you, Mary Ellen? You still on here?
I'm here.
All right, that's my cuz.
Hey, cuz.
Hey.
Here we go. Okay, that's not the one we're going to start with. Hold on. Hold on.
We're holding.
Here we go.
Oh, yeah, Younger for Better Mental Health. You know, we talked about the fact that mental health crisis is upon us. And there are many things we can do to try to help us as we deal with the isolation that goes along with the pandemic. And exercise, of course, is one of the most important things. And yoga is one of the exercises that helps you with it in many ways. And this is an article that talks about the many ways that yoga can be helpful. I think the mental aspect of it is maybe one of the most important ones and is often overlooked. Also, the improved mood that goes along with all exercise as well. Although still far too few people over the age of 50 are exercising. Yoga is actually thought one of the most important exercise ways to restore your health and help you to stay healthy as you age, because aging is something that occurs as long as you live, you age. And so one of the most important things about aging is to have your health. Sometimes we talk about things that are important in life, but few things other than your spiritual health are more important than your mental health and your being able to be pain-free and be able to use all of your body parts, excluding none. So it's one of the exercises that one may do that is among the most helpful of all. John, you do yoga, don't you?
Yes, on average about 4 times a week, and also walk a lot. Yesterday, I got back into walking. I hadn't been walking since I got sick, and I did 7.4 miles yesterday.
Okay, all right. Yeah, I was reading.
Good morning. How are you?
Was reading a lot about the drastic need for blood transfusions, and thought of you and the fact that you can't do it for at least another 3 weeks, right?
I'm going to call today. It'll be another 2 weeks. Yes, after today. Yes.
Yeah. But they said they haven't had such a shortage in more than a decade. But there are not too many of us who can donate. So you're in a special group.
I was wondering if anyone else on the Hollywood Squares does yoga. No
I
takers?
do, John.
Oh, okay. Kevin, all right. Anyone else? If you're interested, I have an excellent instructor who does classes online. So if you text me in the chat, I'll send you a link to her. They're not very expensive, and you can do them for 2 days each class.
My daughter's in sort of.
You cut off, Kevin. You said your daughter what?
My daughter's a certified instructor, so I go through her.
Oh, okay, cool. Anyone else?
She got to pay me back well in one way or another.
Okay. All right. Well, I think this is a good way to start. This is another take on ever increasing number of ways in which pig organs are being used for transplantation. Still, not many xenotransplantation being done using the pigs, but because of the success so far, I think the xenotransplantation is going to be becoming much more common as we get more desperate, as we age and our body parts wear out, and we don't have enough human donors. We talk often about the fact that 20 people die every day because of the shortage of donors, and of course xenotransplantation with pig organs that have been treated to remove the antigenic portions of them that cause rejection is as a consequence. This is a transplant that is going to be becoming more and more popular as success occurs. Of course, as the success occurs, you'll have more of the anti-vivisectionists and the animal rights people who will surface and talk about how this is not good. But if you have a choice of living with a pig heart or dying, living with a pig kidney or dying, then it's up to you. And it's something that is becoming more and more of a reality. Stem cell transplantation and xenotransplantation are our future. Any thoughts about it? We talked about a number of things over time. And we had one of our members who was given the option of living with a machine and elected to die rather than living with a machine. And this is another option that wasn't available for him then. But although heart transplant was an option that he chose not to have. But these are decisions that we're going to have to talk about and discuss more and more. Well, now many of us already have heart valves, and so these heart valves are pigs also. Sometimes we don't know much about it, but so anyway, this is important because I think as we advance, we need to be aware of the options that are available to us as we age and as we need more body parts. So far, the heart and the kidney have been the only ones that have been used so far. So,
Dr. Callender, how long has this research been going on with animals? Because I'm thinking about like
about 30 years.
30 years? Because, you know, we talk about
40 years.
Genetically modified foods that we don't want to eat, but then we look at an animal that has been modified,
Well, you said, some of us don't want to eat. Some do want to eat and they eat them. But with food, it's not an option perhaps of life or death. But with these organs, it's either you die or you accept a transplant. And so it's an option. Nobody forces it on you, but it's an option. It's something to think about before you have to make that decision as to whether you want to do that or not. Remember, they originally started with primate models, but after HIV became an issue, that was taken off the table. And so pigs were thought a safer model. And so they started doing research on genetically modified organs and stem cell transplantations as well.
Mhm. Okay.
This is the same article. Any other questions or concerns about this? Because this is still experimental.
Is there any work with livers?
That's what that was going to be my question. Yeah.
Not well. There has not been one yet. In terms. Now, is your question relating to xenotransplants?
Yes.
No, there have not been any. Remember, these are the first that have been done. Period. And so the liver has not yet been done. No. But the experimentally, they are working on modifying the liver as well as other organs.
Dr. Callender, one thing we can say about this, I think, is that where the liver is a sort of a regenerative organ, that you can get a partial liver and maybe it will grow. That's not the case for the heart and the kidneys.
That's not the case for any other organ. Right. That's what's unique about the liver, is that it's regenerative organ. And we don't know that about any other organs.
Is it possible to have a partial liver transplant from a pig?
Well, we don't know because it hasn't been done yet.
Okay.
Time will tell. We know that the human liver regenerates. To the extent to which the pig liver regenerates, we don't know. So I'm sure that'll be next.
Yeah, I have a friend who's on the list now for liver, and his lady put out a request on Facebook for a partial transplant. How I never heard of that until now, where you can get a piece of a liver. I mean, how much of a liver do you have to have?
I have about
it all depends.
a third to a little more than a third of the liver. Yeah, the left lobe of the liver is what is usually used.
And the donor can survive with no problem.
Oh, yeah, it's done all the time.
Really?
Yeah, wow. Yeah. When you have the live donor liver transplants, that's what's done. They take a third of the liver. We have one lady who gave her part of her liver to her mother 19 years ago, and both are still alive. So yes, it's something that has been done now for 20 years.
Yeah, my question, Dr. Callender, is because I go to Hopkins and my doctor basically said, sooner or later you're going to need a liver. And he told me that because of my MELD score, I probably wouldn't be available for a list to get on the list, and that I should start looking for like a living donor. And from my understanding, because I'm a doctor, because I read WebMD, is that my daughter wouldn't be a good match because male-female livers.
I've never heard that before.
Okay. So I got to try to convince my son to go. You may need to help me out someday, Sean.
Well, son or daughter. But anyway, the difference is the size of the liver for the female rather than the gender. So
right.
Much. But yeah, but this is something that you need to think about because it's something that works. And they've been doing that now for at least 20 years.
So is the wait list for a liver transplant shorter than for a kidney?
Much shorter. The wait for kidney is about 5 to 10 years.
Oh.
Wait for liver is, as he just mentioned, they have a special criteria that they use. And if your numbers are not bad, then they don't put you on the list. But if your numbers are high enough, MELD score is the score that they use. If the MEL score is high, then that means that you can get a liver. If it's low, that means that you're more likely to survive and not need a liver as urgently as somebody who has a high MEL score. MEL score is modeled for end-stage liver disease. Okay, and it identifies looking at your blood work as to whether or not you will die if you don't get a liver transplant.
And they do track it. I can remember with David's first transplant, his was liver, and he was on the list for a year. And I remember this particular year, it was August, he was sick and was in the hospital for a week. And within a couple of weeks, he got a transplant. So yeah, obviously his numbers changed.
That's encouraging. Okay, thank you.
In those days, that was for the whole liver. They weren't doing partial livers then.
No, that was whole.
Yeah. Any other questions about that before we go on to this?
John Tatum was on the list for 2 weeks, right?
You mean for the liver?
Yes.
Are you talking about for his liver?
Yes.
John?
He's muted.
Oh, okay. Well, when he gets unmuted, he can answer your question.
Okay. 3 years. 3 years.
3 years. Okay. Now, this is a interesting article about 4 inventors who changed medicine forever. We've talked about many of the inventors who changed medicine. These are some of the more recent vintage physicians who have done things that have made life better for all humanity. And this is Dr. Giulio Palmaz, who's actually somebody who invented the balloon expendable stent, which now replaces, for the most part, coronary bypass surgeries, unless you have vessels that cannot be bypassed by the stent. And this stent is made, you can see that more than 2 million stents are implanted each year. And what they do is they dilate the vessel and allow the organ to be used for transplantation. And this is something for anybody who has coronary artery disease, which is life-saving.
What's the material that those stents are made of?
I don't know. I don't know what they're made of. Next is Dr. Oz, who you all know his program, but few realize that he has been an inventor of something that it's called a mitral clip, which allows you to have open heart surgery with minimal involvement, so that you don't need to have you have a minimal invasive approach, but you just put this catheter in and one stitch does it. And this is something that they had an experimental group of 312 and the results were spectacular. And now that has become something that is associated with less complications than with the open technique. Then, of course, most people aren't aware of Laennec, who invented the stethoscope. And that, of course, has been used ever since and is the earmark of a physician in medicine to have a stethoscope. He started back in 1816, a good while ago. And then I guess the Raymond Manion is the one who developed the MRI, which now is employed to go from head to toe, and is now used radiological signals to map the entire body and find out whether they're small or large tumors or other problems. And the MRI is now used every day, but this is something that he did 20 years ago. I'm sorry, more than 20 years. He got the award 20 years ago, but this is something that is now part and parcel of medicine. And it's interesting to see how many physicians have been part of the inventor category. Any of you have an MRI? None of you have had MRIs?
Yeah, I've had an MRI.
I've had one.
Yeah, I've had one. This is true. I've had MRIs before.
Yeah.
Sylvia had one also.
Carol has had one.
Janice has.
That's
Don has.
it's interesting when you go in that machine. And if you have claustrophobia, I think David had one also. You had to have one that is open, because they have open and closed.
He had a problem with it. He couldn't go in the machine.
Right.
Yeah.
Yes, they had to give him
I
special.
had one also.
Yeah. So, but it's amazing how God has given us the wisdom to invent these things and help one another out. This is an article that talked about a vaccine that may help. I mean, these articles that talk about things that may work are not something that I pay too much attention to, because it takes time to research and find out whether these vaccines will work. This is something that may work, and time will tell. It takes a lot of research, and just as we did with the vaccines for coronavirus, so it's going to take a while before we know whether this is a dream or reality. Now, what is different about this is when they finish this, that he's willing to share the patent, so that you don't have to worry about whether or not you make money from it or not. But it remains to be seen whether it's worth it or not. So it's interesting to see that, but let's see what comes of it.
Would also be very inexpensive, I've heard.
Yeah, well, if it works, right. But first you got to see if it works or not, right? Okay. The CDC director was really hammered about why they changed from 10 days to 5 days. And she spoke on television and spoke about many of the reasons why they changed. And she stands tall in saying that the 5 days works. Some think that you need to get a test after 5 days, but she's not suggesting that, just indicating that 5 days after systems, if you're feeling asymptomatic and you're well, it's okay to go back to work. So this is our perspective, and things have changed now, and people after 5 days, if they're asymptomatic, they're allowed to go back to work. Any comments or questions about that? That's new development over the last couple of weeks. That some people.
Excuse me. Do they test negative on the rapid tests after 5 days?
They don't. They're not testing, but Fauci was suggesting getting tested. But and I agree with the test. But Walensky was suggesting they can go back after 5 days if they're asymptomatic without the test.
Well, this is especially for the nurses and doctors, though, right? I think that was.
This is especially for people who have been vaccinated.
Oh, okay.
People who have been vaccinated.
Dr. Callender, my daughter, when she got it, when she went to urgent care, they told her, because she tested positive, that once she did her quarantine, which she did for 10 days, that it did not, for her not to take another test, because there was that chance that it was going to come back positive when it shouldn't, because it's a window or something so many days before you take a test that it won't come back positive. And that made no sense to me, but I was like, well, okay.
Well, that's the general feeling is after you've done 10 days. However, most people are not going to let you get back to work unless you have a negative test. Most people aren't going to ask you to have a negative test, but it depends where you work. In our hospital, you have to have a negative test. Otherwise, you can't come back to work.
Is that a negative rapid test or a PCR test?
You have to have a negative test. They don't say what kind of test.
Wow. Okay.
Well, last night on the news, they were saying that PCR test is so sensitive that it can stay in your system. I think they said up to something like 60 days, and you could still test positive for a particular test.
That's correct, but that does not mean that that hospitals should relax their requirements. They still require you to have a negative test. While what you said is true, they still require a negative test. This is the European perspective about it. And there are many perspectives. The question is that we really don't know all the answers. We will know over time. So reasonable people may differ. And these are some of the reasonable people, and they have different opinions and ideas about it. Only time will tell who's right and who's wrong.
Dr. Callender, is it inevitable that we will all catch COVID at some point?
I suspect so, but I don't know any data that proves that. I think so. I think with time, yeah, if you survive long enough, yeah. Just like the flu.
Yeah.
But everybody does not get the flu.
That's true.
Right. So everybody probably will not get COVID. So this is an interesting experience to go through what we've been through, what the people went through in 1918 and 1919. And we're going through it right now, still going through it now in 2022.
Hello. So, Dr. Callender, if you're in a household and some of you get the virus and some of you don't, or the people that did get the virus and you linger on, can you get reinfected or at that same time because one person still has symptoms and testing positive?
As long as they have symptoms and test positive, they can reinfect you. It's possible, yeah.
Ooh.
That's why you want them to be isolated. So they
I'm looking at the picture of this little boy, and when I first got my test, they went deep in the nose with that probe, but I've heard that they don't have to go deep anymore.
That's correct. They stopped doing that a long time ago. They also, there's an article that you see that suggests for some people, because of the sore throat, that sometimes they think you need to also have a throat swab, but that's still being studied. But they no longer do the deep nasopharyngeal swabbing. They do very, very superficial now. They've changed from that. Many of us are old enough to know what the croup is, but some probably have not heard that term before.
Whooping cough.
Yes, that's right. Whooping cough. Yeah, and it's a sound that you make. It's distinctive. It's tough to imitate, but some of the kids that come down with the COVID-19, they have that whooping cough, and called the croup. And it's not the only virus that causes that, but it's one of them. And,
Dr. Callender, is there some type of medicine for whooping cough? Or, I mean, before COVID?
Well, there's a vaccine also as well. Yeah.
So if a child does have the whooping cough or the croups, do they give them both vaccines, the COVID?
No. This is croup from COVID. In other words, that's pertussis is a special germ that causes whooping cough. But COVID can caused the croup, just like pertussis, which is responsible for the whooping cough. It's amazing that COVID has been able to cause diseases from head to toe. So.
I have a neighbor who's having, still has symptoms from catching COVID in May of 2020. And he really hasn't recovered his vim and vigor, and his also he still can't taste.
They call that long COVID, and they say 50% of the people who actually are hospitalized have long COVID and have symptoms for at least 6 months to a year. And your friend sounds like he fits into that category, long COVID.
Well, he never went in the hospital, and he should have gone, but he's just so stubborn. He was scared to go because he said people in the hospital were sicker than he was. Yeah, that was his rationale. So he doctored himself. And one of the things he used was, you know, that little thing that they give you when you're in the hospital to get you to breathe deep?
Yes.
You blow it and the little thing pops up?
Yes.
He was giving his own self-treatments with that.
Well, okay, well, he survived, so we're happy for him.
Yeah, he survived. But he's still, you know, he's still not, you know, back the way he was.
It's 2 years now. Huh?
Yes, we'll be in May.
Yeah, the problem with COVID is that in addition to the acute illness, it also causes chronic illness. And that's something that we don't talk too much about, but 50% of the people who get COVID actually have that long COVID, which stays with you for at least a year and longer. Now, this is an article that talks about kids under 5 who can't be vaccinated, who wind up going to the hospital. And while the original version of COVID didn't affect kids that much, these new variants, including the Omicron and the Delta, do affect kids. So this is something that all of the grandparents and parents are concerned about, the younger children, what to do about them since they cannot be vaccinated. And of course, if everyone else is vaccinated, well, that helps. But yeah. And so most people will just limit their children from playing with other children, but that doesn't work too well either. So. But these viruses have taught us a lot about the importance of vaccines and the importance of washing our hands and the importance of social distancing and wearing masks, which are all important. And this is a common question. How do I know I have the flu or COVID-19? One of the best ways to know is to get tested, because many people who think they have the flu have COVID. And so, and then even some have both. Yeah, but there's such a variety of symptoms that it's pretty hard to tell without getting a COVID test, whether you have a sore throat or not, or you have a fever or chills or not. It varies so much, especially in people who are vaccinated, that having the rapid test available is one of the ways to distinguish it.
Dr. Callender, the long lines that we see, people standing in line, do you think those and waiting for tests, do you think those are more unvaccinated, or do you just think people just want to be tested. I'm trying to see why there's so many people.
They want to be tested. They want to be tested because they want to know whether they have the virus or not. You're right. I think Buchanan was in one of those long lines, right? And and they want to be able to get the test done rapidly and not wait for more than 24 hours. And you can know within minutes. So that's why people are waiting in the long lines.
And now they're having long lines. Now they're having long lines for the test kits. They're giving those away free, but the lines are so long.
I thought that's what she was talking about.
Yeah.
No, I thought she meant vaccination.
Yeah, I was just saying the lines were so long. I'm just saying, do you think they were many who had never been vaccinated?
Well, they
just show tested. Just tested.
They don't have the rapid test, so that you can do your own test at home. I think some of them want to do that. And as you said, there's some who just want to be tested.
In DC, Doc, they have at the libraries and the firehouses and some other pop-up places, they have the rapid test that you can take home and do it in 15 minutes. And they also have the PCR that you can take home and bring the test tube back to the collection site at the library. And they pick those up at 8 o'clock at night, and 3 to 5 days later, you get the PCR back. So both types of tests are available in DC.
The other reason,
and in DC, there is an art to picking it up and not waiting in line. They normally give them out at 12 o'clock. And if you go in there at 1:15, you just walk in, they show your ID, they give you 2 and you can leave. They give you 2 of each.
The other thing about the long lines is that people are in these long lines because they want to go back to work. Some organizations are requiring them to be tested and come up with a negative test before they can go back to work. And that's the other reason for these long lines. They want to go back to work.
Teachers too, right? Especially teachers.
I'm talking about teachers, yeah. They can't go inside the building if they don't get a negative test. And a lot of organizations are doing that. And so people who weren't even going to get the shots, they now have to get tested in order to get back to work.
Right. It's interesting. It's a new world we live in. And here's the Moderna saying that we may need another booster in the fall of 2022, just like we do with the flu. And I guess we've heard that said for quite a while, and most people are anticipating that this will be the case, that you'll need another booster in 2022.
Dr. Callender, I heard on the news yesterday, this is a sidebar, that Congress is trying to stop themselves. They already have a rule that they cannot buy stocks in something before they vote on it. And a lot of congressmen and senators, they bought stock in the COVID vaccine before they made it a law. And so they're making money off of these things. And they're trying to repass the law again, saying that congressmen that are privy to the information cannot buy stocks into these organizations that are making like the,
kind of late.
They're sort of late, like shutting the
That's 2 years too late.
Yeah.
I mean, to me, that's the horse is long out of the barn.
Well, isn't that considered insider trading?
Yeah.
No, not really, because there was no law about it. So
there was a law, but they just ignored it, including the Speaker of the House.
Well, okay, I won't debate that issue because the fact is that when the virus, when the vaccine was first thought about, the companies that were doing it Moderna, and nobody knew that necessarily was going to be successful. So, but anyway, it's interesting to hear that. So we'll see what comes of it. I suspect nothing, but anyway.
And Congress makes the laws, and so when these companies come before them with their products and prove to the Congress that they're safe.
No, they don't prove to the Congress. And that's not accurate. They don't prove to the Congress that they're safe. They prove to the FDA. That's not Congress.
Yeah, that's the federal government.
But that's not Congress. But you said Congress. That is not Congress.
No, I'm not talking about Congress. All I'm saying is Congress has inside information. That's all.
Okay. All right.
And I thought Pfizer was a big contributor to the Republican campaign, especially Trump's.
Okay. All right. Now, this is an article that talks about natural immunity not panning out. I wonder what I think they mean is that if you have COVID, that your natural immunity doesn't protect you against Omicron. And it protects you against some of the other variants, but not against Omicron. And so that's why there's the need for not only the vaccine, but for the booster, because this variant suggests that the immunity that you have is not sufficient to keep you from getting being hospitalized or dying from the virus. And of course, herd immunity, of course, is what some people had talked about being the cure-all, that if we had 90% of the population to get COVID, that the other 10% would be protected. And so this is why they say natural immunity is not effective. That's not true. It's just that it may not last as long. And then it looks as though with the vaccine, it lasts for 5 months is what we're saying now. And the natural immunity may not last that long. And so that's what the discussion is all about. So I don't think that natural immunity does exist. It just may not be sufficient in the long term.
Dr. Callender, just like we have the different flu viruses every year, it seems like that's what's going to happen with COVID. You're going to have a different mixture of
variants.
Vaccines. Yeah.
Variants. Yeah. Yeah, that's what most people are expecting, and that's why you'll see some articles that talk about appealing to the Biden to recognize that COVID is going to be with us like the flu, and help us prepare for that. Well, and not wait for COVID to be eliminated, because it's probably not going to be.
So another question: there are millions of doses of the original vaccines out there, and are they going to go to waste? Are they ineffective now because of these new variants? I mean,
they're not ineffective. I just think that they're, in other words, you still should be vaccinated, and you still should get a booster shot. And the booster shot is demonstrating that it is protective, because those who are vaccinated rarely die and rarely require hospitalization. And that's the purpose of the vaccination in the first place. So it doesn't say that you don't need it anymore. It just identifies the limitations of the vaccine.
Doctor, I heard with one state had 100,000 tests that had to be destroyed because they didn't use it. Do they have some kind of punishment for them? That seems like that's a very terrible thing to do when there are people in other countries, especially Africa, that don't have any vaccine, and that a state would turn it political and wouldn't distribute a vaccine?
Well, where you expect them to? The state isn't capable of delivering a vaccine to another country.
But it seemed like they would get back with the federal government and tell them that they have this excess. Seemed like they would talk to each other or something. I just thought that was such a horrible thing.
Right. Yeah, that was Florida. And it was such a waste.
That's what I'm saying.
It is a waste, but I don't understand you trying to punish them for it.
Well, I don't mean punish, but I mean, I'm thinking about moral authority. Because see, I think in all of this, ethics is being lost. You know, it's no moral imperative to do the right thing and to overlook whether you're a Democrat or a Republican, and just do the right thing. It's finding. I find that morals just go out the window. Ethics just is something that people laugh at, that it doesn't mean anything, and that's troubling to me.
It's troubling to everybody, yeah, because doing the right thing is important, and I think that your concern is shared by everyone. The only thing that I didn't quite understand is how you could punish them for it.
I don't mean like I'm just saying that they should. It should be known that that is not a ethical thing to do. That's what I mean by punishment, because so many things are done, and if nobody says anything about it, people assume it's okay.
Good point. Excellent point. Okay. And I think that in this day and age, our integrity is often lacking.
That's true.
And that's what you're talking about.
Yes, sir.
Doing the right thing, whether somebody's looking at you or not. And that's something that being true to yourself, you can be false to no man. And that is the moral imperative that you speak of, which is critical. That is something that we should always keep in mind. The point is well taken. Okay. Pop-up testing sites. These days, anything is ripe for nefarious activities because you have to be sure that what you're getting is the right thing. Because as you mentioned, everyone does not have the same moral imperatives, and so you have to be careful. And that's why the places that they've identified are places that people trust in, the library and other places. But when they have these other pop-up places, I think they're pointing out, be careful. And you may be taken advantage of. I don't know of any particular place that meets these criteria, but do any of you experience any place like that? They identify places where somebody had a mall parking lot and place in Baltimore. So people who are unlicensed pop up. That's the nature of our democracy that allows nefarious people to take advantage of others.
That same neighbor I was telling you about, he got some tests from a pop-up. I don't know where it was, but when he showed them to his doctor told him he thought that they were some of those ones that were, they weren't real tests, they were false tests and made just for money. Yeah. Somebody had gotten to him. He said because they had gibberish on it. They had American words on it, but it didn't make sense.
Yeah, well, it's sad in this world today. There's so many people who God is their money. Money is their God, rather. Yeah, and so they'll do anything to make money. And that's sad.
I just ordered a test from LabCorp. Actually, they'll mail me the test kit and then you send it back to them Federal Express. and get tested that way, and they send you your results.
Yeah, it's legitimate, right? Mm-hmm. Okay, next one. There's some very, very good news, and that news is while the spread is overwhelming, hospitalizations is not in concert with the huge number of people who have been infected, which is thought to be credit to the vaccine. That's what the vaccine was intended to cause. And that's why it is thought that most of the people who are in the hospital from COVID are unvaccinated. And I think that this is something that still requires us to be careful and take all of the precautions that we've been taught to take. On Saturday, I think it's a basketball game, and they are now doing what they used to do at the concerts. In order to attend the basketball game, you have to have proof of your vaccination. So,
excuse me. What is a negative pressure room?
Oh, that's a room where they have a pressure allowing the exchange to go away from inside the room, and therefore it's become germ-free. And that's the kind of a technique they use in all isolation rooms in the hospital. And it's trying to make the room germ-free.
Okay, thank you.
And it's very effective, and it's the kind of thing that they try to create when they in the airplanes, when they now have a different filtration system. But in the hospital, it's specially done so that all of the circulation goes away from the room, and it's essentially germ-free. Yeah.
But this statement here is one that a lot of people are worried about right now. It's reinfection.
Yes. Mm-hmm. Yeah. Well, legitimately so, because breakthrough infections have become common. So it's legitimate. Yeah.
Dr. Callender, they have some portable air filtration systems out. Is that equal to trying to filter the air to make it pure, like they are doing in ICUs?
Yes, that's the kind of system that they're talking about. Yeah, that they have something like that in airplanes now, and they have that in hospitals all over the country. That, and they need to have more things like that in restaurants. If you're going to have people eating, you need more filtration like that.
Is that really something good to have in your own home, those portable filtration systems?
It depends on who you have in your home. If you're going to have a lot of people who are unvaccinated, it might be something you might want to do. But yeah, if you're going to have events in which people come in that are unvaccinated, it's probably a good idea. I don't know how expensive it is, though. A lot of people ask for where the COVID tests that Biden promised, and I guess they're at the libraries and other places because they're all free. But many people haven't had access to them, and so this has been a question. The drugstores don't have them, but the places that you see people having those long lines, that's where they have them. And, so. But this has been a subject for much discussion. In the UK, they've done this to the ultimate degree, but we have not. We're just starting it here, but it's something the UK has been doing for some time, which we are late in catching up with. And of course, this is something new that the insurance will pay for the cost of at-home testing, the same way they cover the cost of PCR lab tests. This is something that has just happened, so that your insurance company will take up the cost. That's a relatively new issue that Biden has provided. This is another article that points out that hospitalizations and deaths are very rare in fully vaccinated adults, meaning people who've fully vaccinated now means that you not only have been fully vaccinated, but you also have the booster shot, and which is expected 5 months after you gotten your initial vaccination.
Dr. Callender, they approved the booster for, I think it was children 12 through 15 now.
That's
Do you
correct.
know if they've already started it? Is it already in action?
Yeah, it's in action. Now,
Okay.
yeah, I mean, in other words, FDA has approved it. Now, that's the first step. In terms of actually making it happen, that's another one. Okay, Carol, we miss you. Stay safe. That's the other issue. We're still having, some churches are still open and some churches are closed, and we're still having funerals and those things. And it's desirable that they actually have masks and that they have social distancing. One of the things that we talked about last week is the type of mask that people use, and the importance of the layered mask and the cloth mask is thought not to be safe. So,
Dr. Callender, I have a cloth mask that has a pocket in it to put a filter. Are those safer?
Layered masks are thought to be safer, but cloth masks that are not layered are not safe. Not safe from the Omicron variant, anyway. That slide you just showed points out those people who are in the category of at risk. And pulmonary disease, liver disease, chronic kidney disease, neurologic disease, diabetes, and cardiac disease. This is important to know, because if you fall in that category, then you are more likely to have a severe outcome. And it's interesting how this explosion has affected services everywhere. Classrooms, hospitals, you name it. My Omicron explosion has been devastating to the economy and to everything else.
Yeah, a lot of people are driving instead of flying too.
Sounds like a good idea. Yeah, that's what Joyce did. Yeah. Actually, the airplane is the safest part of the trip. The most dangerous part of the trip is waiting online and walking through the airport itself. But the plane itself, especially if they require all people who get on board to wear their masks properly. which is more than a notion nowadays.
Are so you're not required to be vaccinated to fly, though, are you?
No.
Mm.
But you're required to wear a mask. But sometimes if they don't police that. Well, plus, especially if you're going to have people eating and drinking, then how can you police that? So you kind of put in a situation where the way it's safest if they don't pass around food and drinking, because that means you can't wear a mask. So,
yeah, Dr. Callender, that's exactly how I think I caught it. We performed at a very large hall. It's the Martin's Crossroads.
Yeah.
And it was like over 300 people in there. And everybody had the mask on the dance floor. But when you go back to your table to eat your dinner,
right,
who eats with a mask on? It's not
nobody. You can't.
So you can't do it.
So it's a paradox, right? Yeah. Well, I guess most people are hoping that what happened in South Africa is a short-lasting thing. Will be the same thing in the United States, and by the end of this month, it'll be gone. But we shall see. It's interesting. They haven't called it the South African virus. Yeah.
If Trump was president, they would have.
Yeah, right. That's amazing. Yeah, hospitals everywhere is affecting the shortage of employees for a number of reasons. Well,
1,600 teachers were absent on Wednesday.
Can you imagine? Yeah.
But it's hard to even get the children to school because they don't have the bus drivers to even get them to school.
Yeah.
I was surprised they called the National Guard out just to drive a school bus.
I'm not.
But that's what they did in Montgomery.
Yeah, I'm not surprised. They do all kinds of things.
But did they
You'd be
follow
surprised.
through on?
They use the National Guard for anything.
Did they follow through on that? Because I was hearing where, I don't know, it was Maryland's National Guard that said they were doing testing sites and vaccine sites or something like that. So I didn't know if that ever went into effect or not in Montgomery County.
I don't know about Montgomery County.
I think it did.
The National Guard, they responded and said that they were not at that time going to be driving school buses.
Right. Yeah.
Because they showed it yesterday on the news, and a spokesperson from the Maryland National Guard, and they said that they would not be at this time driving school buses because just what you said, that they're doing testing sites and all of these other different things, and they were like, they're stretched thin.
Everybody's stretched thin. Yeah. Well, this is what we spoke about a little earlier, that some are suggesting that saliva tests be used as well. That's still not official, but we need to look more into the details so we can really have an answer to that question. But anyway, this is something that is on the table at this time. So I think it's too early to say. Right now, most of the sites are still only doing nasopharyngeal swabs. And coming up with positives. So one of the things that is different about this situation is that we're learning as we go. And what is true today is not necessarily true next week. So we have to be flexible and adjust our positions as time goes on. And as the data demonstrates the necessity for things. So time will tell whether this is accurate or not.
This is a little off the subject, but did anybody see the news clip where they were talking with Dr. Fauci? I think a senator, congressman, somebody, and he kept asking him the same question over and over again. And then in the end, Dr. Fauci said, "What a moron." They were talking.
That was Rand Paul.
Yeah, Rand Paul. Yes, that's who it was.
No, that was another.
It wasn't Rand Paul. It was some other senator.
Yes.
And he was reading from, someone must have handed him that question, because he was reading from, he was reading from a piece of paper on his desk about, Fauci's finances.
Right. Yes.
And Fauci was saying, well, it's available. My book's open to anybody. And the guy didn't know what to say after that. And Fauci just said, moron.
Yeah, what a moron. I was like, okay.
But isn't Rand Paul supposed to be some type of doctor?
I think he might be a dentist.
He's a doctor. He is. That's why they battle so much.
But what kind of doctor is he?
I don't remember. I can't remember. But
he's
he's
a
mad
doctor.
He is a physician. Yeah.
But he must have forgot stuff.
I don't know if he forgot. He has a different opinion. Different strokes for different folks. There's some people who believe and some don't believe. So you have different opinions. So you have different schools of thought. And he definitely has a different school of thought than Fauci. And the data doesn't often support his position.
But it gets him elected. It gets him elected. And it gets some fundraising.
Well, it's interesting that this Omicron hospitalization records are far exceeding the past pandemic. And so that this is really frightening people.
Rand Paul is an ophthalmologist.
Oh.
Which is a physician and surgeon who treats eye conditions. Well, I think this is enough for us to recognize that this month we have to try to stay safe as best we can in the face of the increasing numbers of people who are being infected. I'm sure that none of us can say we know no one who's contracted COVID.
Right, yes.
All of us have experienced, and some of us have experienced people who've died from COVID. Many of us have experienced people who've died from COVID. Not only been infected, but actually died from COVID. And people are still dying from COVID. And so it's important that we not forget things that we've emphasized from the beginning till now. Washing your hands, masking, social distancing, and getting vaccinated. And trying to stay safe. That's all you can.
Yesterday, I was looking on Amazon for something and it came up with these masks. But then I'm looking and the free test kits that they're giving out to everybody's on Amazon and somebody's selling.
Say again?
This is just the free test kits that we get. Like you go to the library and things like that. Somebody now is selling them on Amazon.
They've been doing that. They've been doing that. Yeah, that's right. They're doing that.
That should be, is it illegal?
No, why should it be illegal? If you want to buy it, you can buy it.
Wow.
Yeah, it's
I
free,
thought
but I
maybe it was
mean,
illegal because if it's free, then how can you sell it?
easy.
I mean, some people don't want
You
to
can
wait
sell
in line.
anything. You can sell anything.
Okay.
Yeah, sell anything. Just because it's free doesn't mean you can't sell it. Somebody will buy it.
I see.
Yeah, and I think Cheryl told us that she got her. Didn't you tell us that you got your test?
Yeah, I did get some. Yeah, I did get some test kits from Amazon.
Right.
And I ordered the one from LabCorp as well. Now, LabCorp, you can either opt to pay out your pocket or give them your insurance information.
And insurance will not pay for it, right?
For LabCorp, yeah.
Yeah, insurance will not pay for it.
Will not.
What's the cost of a test kit online when you purchase it online?
Like $23 for 2 tests.
Not bad.
That's what it was what it cost before. This is what COVID tests can and can't tell you about being contagious, which goes along with what somebody had said earlier. The fact that some people, there are exceptions. Some people keep testing positive for COVID weeks and months after, and they, even when they're no longer contagious. And that's the point that I think somebody was making. And that's why somebody advised them to not get tested unless they had to, because sometimes you could not be contagious and still test positive for the virus. How do you handle that if you work at a place that requires a negative test? That's a good question. I think you have to see your infectious disease expert and let him interact with the institution.
Dr. Callender, at the hospital, how often do you all have to get tested?
Weekly.
Oh, okay.
At the hospital and at the university.
And that's mandatory, correct?
Tests are not mandatory unless you turn positive. If you're positive, then you have to, but they're optional. Now, for students, they're not optional. And it's not mandatory for you to be tested at the hospital unless, if you're vaccinated, you still have to get a weekly test, but it's not mandatory. It's recommended.
Oh, okay.
Now, if you have any symptoms, then it becomes mandatory.
This is the one Cheryl was talking about, I think.
Right. That's right. Exactly.
Oh,
even though they're not contagious. Even though even though they're not contagious. And yet, if you test positive at rapid, you could still be contagious, they say. So there's 2 different schools of thought on that. For the most part, the CDC is saying if you asymptomatic, after 5 days, you can go back to work. It doesn't require you to take another test. However, many jobs require that you can't come back until you have a negative test.
Oh, okay.
So there are circumstances where you go to your infectious disease expert and let them deal with the institution regarding your particular circumstance. Recognizing that we don't know all the answers. And things are changing weekly, if not daily.
Right. I find a lot of people uncomfortable with that, but that's what happens when you're something new that the doctors are working on. You know, these are not the 10 commandments. They're not written in stone. They're changing, and that's a good thing because that means that they're working on it. I find comfort in that they're not so rigid, and I find that makes me feel that they're working on it. But a lot of people, that's what they are upset about Fauci, because he says one thing this time and then one thing another, but that's how it is when you're testing and experimenting and doing things like that. You can't be certain.
Well, it's interesting that in 1918, when they had no vaccine.
Right.
We're fortunate we have a vaccine, and we're fortunate, as you mentioned, that we can learn as we go, not be inflexible. I think your point is very well taken.
Dr. Callender, I'm asking on behalf of someone else this question about vitamin C. What happens if you have an overdose of vitamin C, and what is the daily recommended dose?
Well, actually, it's interesting that you asked that question because overdose of vitamin C can give you gastritis, can give you, I guess that's probably one of the most common problems is gastritis. The recommended dose is probably a gram a day. But Linus Pauling won a Nobel Prize.
1 gram a day.
Right.
1 gram daily.
Linus Pauling won a Nobel Prize for a number of things, including his work on vitamin C. But a lot of things have changed since then, and of course he also recommended astronomical doses of vitamin C to prevent colds and such. And there's a lot of data that is not supportive of his positions on that. And so the amount of vitamin C that you need to take and the amount of vitamin C that people take may be two different things. So I think a gram is about all you need a day.
Okay, thank you. I will pass it on.
Any other comments or questions? We've talked about a lot of items today. And I guess one of the most important things that you brought up was that change is what's going on. And we have to be aware of what's going on. And things change weekly, if not daily. And so we have to be flexible, willing to learn from the data that is shared with us. And I think that it's clear that nobody knows all of the answers.
That's right.
And we're learning as we go. And that is something that we have to keep in mind so that we can